Thank you so much. Good afternoon, everyone, and I thank Directorate for giving us this opportunity to talk on this very important topic of every newborn action plan and ending preventable maternal mortality. So I'll start with the presentation. Every newborn action plan and ending preventable maternal mortality global and national targets for 2025 and the SDG 2030 targets. So as we start discussing what this plan is all about, the first thing is WHO has come up with a framework which has certain coverage, targets and milestones. So we urge the countries and the states to adapt these framework as per their requirements, as per their plan and policies. So this is a broad guidance and each state and further to each state, each districts and the block. We urge the districts and the block as we see there is a lot of inequity even within the states to take up these plan and have a holistic view to the maternal newborn health issues and approach to it to achieve the SDG targets. And Tamil Nadu has already achieved the SDG targets for maternal mortality. So we have achieved the outcome and there are various others quality concerns, community participation that can also be looked, and also Tamil Nadu can act as an exemplar state for rest of the country and also globally when we have these global evidences coming up and WHO comes up with evidence after rigorous research. So we would also like to showcase how India is doing, how Tamil Nadu has done that and showcase this to the rest of the world. So to start with the background, in an effort to accelerate progress towards SDG targets and goals, EPMM has established coverage targets and milestones to track the progress to 2030. These coverage targets and milestones, as I mentioned, were developed in consultation with relevant stakeholders, partners at national, regional and global level, and also ensured alignment with the target and the milestones launched by every newborn action plan in September 2020. So first, every newborn action plan came and then EPMM, and they both were aligned. We know the importance that the determinants of the maternal and the newborn mortality are quite interlinked, which we will see later. So we need to put the mothers and the baby plan together, mother, babies and the child plan together. So what is this ENAP EPMM coverage targets? The nomenclature is 90-80-80. So yes, 90-90-80-80. So what is this? So as I mentioned, in 2020, every newborn action plan came and then ENAP came, EPMM came, that is ending preventable maternal mortality. Then what we did was, there was few targets which were common to both. The ENAP, EPM, we can see that in the center, the ENAP, EPMM shared targets, and what this nomenclature 90-90-80-80 is, the targets are set for global, national and subnational, that is the district level. So the target 1, 90% coverage of 4 or more antenatal care contacts. Target 2, 90% birth attendance by skilled birth attendants. Target 3, 80% early routine postnatal care within 2 days. And the subnational target is 80% of all district coverage for 70% ANC4, 80% skilled birth attendants, and 60% PNC. So these are the shared targets, and we understand Tamil Nadu has achieved most of the targets and all the shared targets. So what is the position currently district-wise? And within these are the outcomes. So there is a pathway. So at what stage each districts are in that journey. So the districts can come up with their own action plan by arranging the existing programs, infrastructures and finances. So, and then what were the additional target with every newborn action plan? That was target 4, that is target 4, the national implementation plan for inpatient units and sub-national inpatients unit level 2 plus CPAP. Subnational is 80% of all districts with at least one level 2 inpatient units plus CPAP. Inpatient units in India, we call it SNCUs, we are referring to SNCUs. And then ending preventable maternal mortality indicators, the additional one, the target 4. More than half of the population within 2 hours of emergency obstetric care. Subnational, 80% of all districts with at least half of population within 2 hours of emergency obstetric care. Target 5, more than half of the women making their informed, empowered decisions. 80% of the districts with more than half of women making own informed, empowered decisions, that is at the sub-national level. And now then comes the role of the states to define what is this own informed, empowered decision for the state perspective, for the decision, how are we going to measure these? So state has to plan for it. And then there are shared milestones. There are 10 shared milestones. So these shared milestones are policies and plan, quality of care, equity, data for action, investment, health workforce, response and resilience, commodities, accountability, and research, innovation, knowledge exchange. So we see that with this ENAP, EPMM framework, we are literally covering all the areas, all the headings of the health system and all the other allied areas which needs to be addressed when we are looking at the maternal newborn health. So there shall be a sub-national plan, then national, and then obviously there is a global plan, which I am currently showing it to you. So achieving the milestones, then what is a plan to achieve these 10 milestones at national level, at state level, and within state with the districts. Then achieving the coverage targets, which Tamil Nadu state has already achieved. Has all the districts also achieved those targets? Achieving improved maternal and perinatal health outcomes. It can be the mortality and also not missing the morbidities and the other allied factors which may not be the lead to mortality but affects the quality of care of mothers and newborns. And then obviously achieving SDG and other global targets. So Tamil Nadu has already achieved that for maternal health. There has been a series of documents and policies which has come up to support the member countries and the states to draw this whole plan. It was Every Newborn Action Plan in 2014, then Strategies Towards Ending Preventable Maternal Mortality in 2015, then EPMM Ending Preventable Maternal Mortality, and that was in 2021, and then UNICEF, WHO, and UNFPA, all the UN organizations came up with Improving Maternal and Newborn Health and Survival, Reducing Stillbirth. That was in 2023. So why we talk about ENAP, EPMM shared targets? Why? So the reason being, the mortality determinants are interconnected for pregnant women and their babies, as are underlying health conditions, interventions, service delivery platforms. Hence, an integrated mortality transition model is needed. And we understand, though in ENAP, we are seeing the outcome as the neonatal mortality rate and the stillbirth rate, and EPMM is looking at maternal mortality. But to bring down the mortality rates, there are various other factors which requires this integrated mortality transition model. So that spans from preconception till the beyond survival of the baby. So there are 6 pillars. It's preconception, antenatal care, delivery care, care at delivery, and beyond survival, which also includes the ECD. Then the need for integrations, these issues are interlinked and often analyzed separately. We need to bring a coherence to it. Mortality determinants, health conditions, and interventions overlap for babies and mothers. So rather than having dual approach, we can have a convergent approach. And integrated mortality transition model is hence required. So there is some overlap at the heading, apologies for that. So this is the global plan which at headquarter level, this has been shared with us that all countries are working to achieve the ENAP, EPMM mortality and coverage targets. Therefore, all countries are invited to develop MNH acceleration plan as the part of national RMNCH strategies and plan. And we request at the national level also and at the state level also to come up, and we can support in those strategies and plans. Development of implementation of MNH planning is undertaken by MOH with support of the RMNCH strategic coordination body or its equivalent. And whatever plan we draw, that is in coordination with GOI and the state governments. Call for all partners, and for this whole action, all the partners will be working together and support the respective governments at state and national levels. And the 3 organizations, WHO, UNICEF, and UNFPA are well placed to support the MOH, and in this endeavor, we are working together. And so there is a timeline to it, and it's suggested to meet every 2 years to see that the whole, say for example, Tamil Nadu, for all the states, are we moving at this right pace to achieve the SDG targets? So stage 1, which is 2023 to 2025, is development of the MNH acceleration plan. Stage 2, mobilization of additional technical and financial support from in-country, regional, and global partners. So say, for example, we are well equipped at the state level. If we need some support from the GOI, we shall work for it. If there is some support required at the global level, our team shall support for those activities also. And then periodic monitoring and reporting progress on implementation of the MNH acceleration plan. And this whole plan is not a vertical. Basically, it's a convergence of already all the efforts which are going on for maternal and child health. So there are 5 priority actions. This has been taken from the ENAP EPMM Joint Progress 2023, which we need to focus on. First is the level of ambition and investment must match the targets. So we need to align the ambition and the investments in terms of planning, target setting, financing, HR allocation. For example, for the normal and sick newborn care EMOC, local implementation is critical for national progress, resource allocation and tracking progress. So sub-national plans for equity. India is a large country with a lot of variation between the states, within the states. So there is a need for local implementation of the plans. Systems should be adapted to deliver quality of care. So when we say we want to give respectful care to the mothers and the baby, is the system conducive enough to render that support? Are the healthcare workers also respected and supported in a way to deliver a respectful care? Those also, so we need to think how to make this conducive environment. Families and community, that's a very important, and that is more so for, I would say, for states like Tamil Nadu who have already achieved the outcome targets. The families and the community needs to be in partners. So whatever program we are planning, the community and the families will play a huge role in that. Their participation, their views, what kind of health services they are expecting is also very important. And then comes notifying, reporting deaths. Say for example, MP DSR. So are all deaths reported? And once reported over MP DSR, are we analyzing that where are these deaths happening, and what are the causes of death? Because even one death is we need to work on those. So to support the country ENAP EPMM work planning, monitoring and tracking progress, our team has developed following tools and templates. So 1 to 6 are the tools and templates which we have. This has been taken after rigorous global research, then already existing WHO recommendations. So these are MNH acceleration plan and technical support planning and reporting templates, feedback and synthesis templates, country tracking and reporting database, ENAP EPMM country profile 2023 and tracking tool data 2022, packages of intervention sheets, which is the best buys in development, ENAP EPMM measurement improvement roadmap, advocacy communication messaging, which will be developed in early 2024. And then there are links to the already existing guidelines, which is the PPH roadmap, the KMC guideline, the SSNB implementation guidelines, and there are other various WHO guidelines, and the evidences have been taken up from them and aligned with these 6 packages. So we would be happy to share with anybody of you who even wants, for the sake of knowledge or for implementation, we would be happy to share all these material with you for your own implementation. And then the EPMM partners urges governments and maternal and newborn health stakeholders to adopt the EPMM coverage targets in their national policies and strategies to improve the maternal health along the continuum of care and reduce maternal mortality in the specific context. And for us, already these indicators are present in the government monitoring system, the HMIS and the RCH portal. So these indicators are not new to India. Convene national stakeholder group to establish national and sub-national tracking and accountability mechanism. So we would request states to form their own technical advisory group. This technical advisory group can guide state two ways. One, their own experience in field, their expertise. And the second part is they can look and they can support the state in the data part, which is already with the state. So state can look into and deep dive into their data to come up with the policy implications. Then enhance the domestic resources and impart domestic human resources to address the disparities in maternal health. Exert leadership within the donor community to drive more effective use of cooperative resources and strengthen intersectoral policy dialogues. So we see there are 6 pillars which starts from preconception till beyond survival. So there's a lot of intersectoral communications and partnerships which shall be required to address this whole thing in a holistic manner. So I would be happy to share all the material. I'll be sharing those material with the directorate. Anybody interested can take from them, and I will also share my details for any further communication guidance. So I would be happy to address that. And thank you so much for your patient listening.
Thank you so much for your pearls of wisdom, ma'am. You not only explain the steps in detail, but also help us to share your tools for us. Thank you so much, ma'am. Now the podium is open for any questions to be asked or doubts to be cleared.
Thank you, madam. I cordially invite Joint Director, Maternal and Child Health, Dr. Nirmal Singh sir, to felicitate this speaker with the memento.